Unit 1.4, Video 2. In this second video, we will present very briefly those diseases that are related to the acquired disability condition, directly related, such as intestinal transit disorders, dysphagia, and sarcopenia. The first disorder we will briefly describe is related to intestinal transit disorders. Patients, especially suffering spinal cord injury, they frequently display neurogenic bowel dysfunction due to the absence of central nervous system control over the gastrointestinal system. And such condition is frequently associated with constipation. Well, the origin of constipation in patients with these conditions is complex and includes disease-related nerve dysfunction, as well as generalized systemic factors such as altered solid and liquid diets, impaired mobility, and psychological disturbances. Furthermore, some drugs frequently used in the treatment of spinal cord injury may also cause constipation. The use of laxative is frequently needed in this kind of patient. Second condition is defined dysphagia. Dysphagia, which is difficulty in swallowing, is a very frequent morbidity which can occur following acquired brain injury. Although the severity of dysphagia can vary, it can cause psychological and physical consequences such as anxiety, social isolation, increased risk of other diseases like pneumonia, or increased risk of other pathological conditions like dehydration or even mortality. Weight loss and poor nutrition are other possible complications of dysphagia. Well, consider that a deeper discussion on dysphagia and its management is reported in Unit 3.4. The third condition, which is related to the acquired disability, is called sarcopenia. Sarcopenia is a syndrome characterized by progressive and generalized loss of skeletal muscle mass and strength, and it is strictly correlated with the physical disability, poor quality of life, and death. Risk factors for sarcopenia include age, gender, and the level of physical activity. Also, in this case, I invite you to follow a supplementary video which have been produced. Thank you. The participation of Professor Chicho, where he described deeply different aspects of sarcopenia.